Well, hello again, Pastor Ray Barnett here with you, and I'm glad that you could be with me here on the Oasis. As always, I wish you a good morning, good afternoon, or a good evening, depending on what time you're watching this broadcast. Hey, let me just say it's another kind of a cold day here, December the 8th here in upstate New York, but still, this is still the day the Lord has made, and we should rejoice and be glad in it. Let me just take a minute to welcome all our new subscribers. We're gaining a subscriber or two almost every day now, which is good. And I want to just welcome all of you, many of whom I don't know by name. But in the course of time, hopefully, we build up this kind of a relationship here on the channel, which is dedicated to God's answers for anxiety and depression. I want to mention again, as I did yesterday, that this channel here, as you know, as I just mentioned, is dedicated to overcoming anxiety, depression, mental health disorders or situations. And as I said yesterday, it's very, unlike many YouTube channels where you can kind of hop, skip, and jump over things. This channel is very much dependent, these lessons I should say, is very much dependent on you sticking with me through the broadcast. Now I try to keep it to 15 to 20 minutes, which is not really a whole lot of time. However, in the culture in which we live, where we're image oriented and we kind of just click on and off things, let me say politely, you won't get a whole lot out of these teachings if you do two things. If you kind of get bored within the first few minutes and you say, oh, this guy's not saying anything, we're not going anywhere with this, and I'm done. Which in my case that would be fine, but it won't be good for you. Secondly, it's very important also that you watch these videos as often as possible. I know that it's not always possible to watch every single day, but you would be best served if you did. And as I said yesterday again, just try to notch out those 15 or 20 minutes when you see this video goes up so that you get the entire lesson. I shared with you yesterday an illustration from music, particularly drumming, but music in general. It has an introduction, and then there's a middle, and then music usually always, well, I won't say always, but most times resolves itself by the end, because music is always looking to do that. It's always looking to come to basically the place where it started. So these messages and these lessons and exhortations are kind of designed the same way. They're designed to have a beginning, a middle, and an ending, and it'll take me 15 to 20 minutes to do that. So it's up to you if you stick with me or not, but again, under the assumption that most of you are tuning in because you have some either interest in or problem with anxiety and depression, you're going to be best served by those two things: sticking with me for the entire lesson and watching these videos as often as possible. All right, let's jump in to today's lesson, which is overcoming anxiety and depression by using your muscles, or using your muscles to overcome anxiety and depression. I mentioned this yesterday on the December the 7th broadcast, so it's basically a continuation. Some years ago, a few decades back, let me say it this way, the greatest advances that we have seen in medical science has been in the area of neurology, understanding more and more about the brain, how the nervous system works, and so on. And I believe it was the University of Montreal, that's what my recollection is. Some decades ago, they discovered that in your gut, right, the GI system, in the muscles, in the cardiac muscle, the heart, and various parts of the body, they discovered what is typically called, in a very non-technical way, little brains. They have discovered, and there's again more advances being made in this area, that the heart muscle the skeletal muscles, the GI system, actually has the ability, it's kind of quite amazing the way God designed the body, they have a capacity to actually think similar to how the brain works. So they're called little brains. And your muscles, along with the cardiac muscle and the others I just mentioned, have the ability to communicate to the brain in this neural capacity. All right, so what does that mean to you? Well, as I always say on these broadcasts, these lessons are simple, not easy. So we have to be clear about that. These are not the quick fix type of things that you get on so many videos. And a lot of the because I've watched a few on anxiety and depression, they're kind of little hacks, which are good. They're very, very good. The ones that I watched were good. But these, what I'm trying to give you is not a hack, but to give you better insight into, what's going on in the brain, what's going on in your body when you're down, when you're anxious. Yesterday we talked about panic attacks. And I stated that what you need to do is to move your muscles, no matter how, for instance, with depression, no matter how fatigued you may feel. That fatigue is merely that. It's just a feeling of fatigue. It's not real fatigue. So, with that being understood, I'll use the word jumpstart. You're down, you're depressed, you're anxious, you're nervous. And there's this fantastic truth that's been known for many years. Again, if you've seen the video I did just a couple of days ago, I gave you the Latin term soluitur ambulando. It is solved by walking. It's ancient. I mean, this has been known for a long, long time. Your best ideas, your best inspirations, thoughts, problem solving comes when you're relaxed, but it also comes when you're using your muscles. And again, I use the word jumpstart. It kind of jumpstarts the brain. So we start here with the brain. And it is reacting to sensations inside the body, which may have nothing to do with your outer environment, your home, your job, whatever. But in most cases, it does. Your brain is responding to what it sees and hears and feels from the outer environment, anything that's outside your body, as well as what's going on inside your body, which again may be independent of circumstances, external circumstances. But in most cases, it's a combination of both. So what you want to do when the brain is in a place of defeat, when the brain is in a place where it's really shook by disturbances going on inside the body, and we throw in disturbances in your outer environment, your job, the home, the marriage, the children. Okay, so we know these things already. What you want to do is get the brain to be affected. It's fearful, it's discouraged, it's, you can name it. And it's putting you into a depression or a state of nervousness and anxiety. And some of you I know have long histories with this. And they are, as I told you before, they are quite frightening and difficult. So you definitely have my empathy and certainly my understanding of these things. Really what I'm doing with you here over these almost 2 years that I've been on the air is teaching you how to discipline yourself. That's really what this is all about. It's about living a disciplined life to overcome anxiety, depression, and so on. I did tell you the story, and I'll just mention it quickly for the new subscribers. I've worked with quite a lot of people with problems with anxiety and depression, and one woman in particular, and there's been more than one, but one I mentioned to you, who had 33 years of diagnosis of schizophrenia, had all the classic symptoms, including electric shock therapy treatment, the heavy-duty medications, Haldol, Thorazine, Mellaril, Stelazine, all these things. And her case was pretty hopeless. She came to the class that I did some years back, where I had just basically 12 people who were regulars. Anyone was invited, just like with this channel. But not many people stick it out. Their anxiety is too high, perhaps, their depression too deep, and they get discouraged upon their already pre-existent discouragement, and they just really simply quit. And I really hope that you don't do that. I hope that you just stick with me and bear with me when you just don't either agree or understand what I'm talking about. But my experience and my understanding in this subject is pretty good. Anyway, I had this woman who had 33 years of schizophrenia and so many hospitalizations over those 33 years that she couldn't stay out of it. She had never stayed out of a psychiatric unit for more than 2 weeks in all those years. Yet, this is the short version of her story. I was able to work with her in my group, and she overcame every single symptom, And I told you before that really is pretty much bordering on the miraculous. Then again, these techniques, they do work. And so I'll come shy of saying that it's a miracle. My belief is that this can be done, I'll say almost everybody. I want to say everybody, but a lot of that depends on you. Okay, so today you're down, and today you're depressed, or you're anxious. And remember that anxiety and depression usually go hand in hand. One is more dominant, one is more recessive. But they're usually both there. So what you do is you use the muscles to help the cerebral manager, right? The central management is up here. These little brains are able to communicate to central management, to the brain. And basically, just to put it into a kind of an allegory or kind of an analogy, by moving your muscles, it can jumpstart the brain by sending a signal saying, hey, you up here told us down here that we're fatigued. Now we're moving, and we here in the muscles, right? In fact, in the gym, it's been, almost everybody knows this statement. They took a year off from working out, and people say, don't worry about it, there's muscle memory. And I used to always, I'll be honest with you, I used to always cringe at that statement, say, muscles don't have memory. Come on, man, But they actually do. Now, neurology and the folks that work in the field of neurology have proven it. Okay, so the muscles, we're going to move the muscles, and it's going to send a signal back to the brain. So you know what? You here told us here that you're fatigued, and that we're fatigued, and we just got to sit in this chair. We got to lay in the bed. We're not going to shower and shave and dress and all these different things. We're not going to go look for a job. We're not going to do these things. And when you command your muscles to go for that walk, salvitur ambulando, you start just going around doing the housework that you've been avoiding, even your muscles of speech, making yourself to speak, not so much in the typical defeatist type of language, because language, the things that come out of your mouth, or even what you're hearing, has a great effect on central management, on the brain. So you want to even be careful with your words. You want to use the muscles here surrounding the lips and the throat to not always be complaining, and also be careful of adjectives. For example, if you have a headache, just simply say, oh, I just got a headache, rather than this type of a statement. I just have an amazing, splitting headache that is excruciating. Now, sometimes it is excruciating, but rarely is it that dramatic. Most times it's simply a headache. And by saying, no, I got a headache, you diminish the symptom by using the muscles here around the face, throat, to speak. I'm not even saying more positive, you just speak the truth without all the adjectives. Then you diminish tension. This is our constant theme on this broadcast. Diminishing tension in the body. So, I just got back from the gym a couple hours ago. I go every single morning. I've done it for all my life. I don't work out because I'm such a great athlete. I mean, I do hit some pretty good numbers in the gym, but that's just what I do. I do it because it makes me feel good. And anybody that's in the gym, all the gym rats like myself, we all know that coming here. Like a guy just told me yesterday, he's my age. I'm 60, I'm going to be 68 in a couple of months. He told me, he said, this is my happy place. And I told him, I said, yeah, me too. I look forward to getting up in the morning. I do my reading, I do my prayer. I do reading of the Bible, then I do some more reading and practice on the guitar for a little bit. And then I'm off to the gym. And no matter how I feel, even if I'm physically not feeling good, I mean, it's a real physical thing, bad cold, stomach thing, I always feel better when I come out. Now, why is that? Because the muscles here that have these little brains is communicating to central management, say, you know what, you got up and did something today that central management said you couldn't do. But the muscles are telling the brain, hey, you know what, we were able to do this. And then we have all of the physiology, the hormones, the so-called pleasure hormones, the endorphins and so on, that are created. And you feel a lift in your spirit. So, to be brief, as simple as this sounds, and I'm always saying to you, simple does not mean easy. You get up and you say, okay, I'm going to trust Pastor Ray's expertise. One thing people know of me, I'm honest and I don't lie. Again, I remind you, I'm not on this channel to bring attention to myself. I've already got enough of that wherever I go. Sometimes it takes me a half an hour, I'm not kidding you, to get from the front door to my locker in the gym, because people just talk to me. Some of them have problems. Met a guy today, pray for my wife. That's just what I do. But to stay on point, you move your muscles despite how you feel, and you start to, and the central management here, the brain, starts to learn by experience that, wow, I can do this. Maybe you've been years in a position where you haven't been able to do much at all because of this condition, your nervous condition, because of your symptoms. Now all of a sudden, a new habit's being formed. You got up and you started walking around the house. And you ventured out and you said, I'm going to put my sneakers on or my boots, and I'm going to go out and take a walk on the street. And all of a sudden, there's one lesson learned. Hey, you did this. For years, you couldn't do this, or wouldn't. But now you're learning that you can. The brain is learning. So see, there's a cooperation between the neurons that are in the skeletal muscles, cardiac muscle, the gut, other places. There's a communication going on. And the muscles, in one manner of speaking, is saying to central management, hey, you know what? It can be done. Central management is cringing. It's defeated. There's defeatism and discouragement and depression, anxiety, anxiousness, nervousness. But the muscles are saying, we can do this. And so there's a cooperation in the body, and that's exactly how God designed it. The body's just, I've kept up on my anatomy and somewhat on the physiology for years and years since I studied it in college. And the body just amazes me. It really does. All right, so here's the thing. You can overcome your anxieties and your depressions by using the muscles, by commanding the muscles to, again, go for that walk, go clean the house, which you've been neglecting. There's so many things that you could do, but the main thing is not that you become a champion power lifter or anything like that. The main thing is that you use your muscles to jumpstart the brain, get them back into coordination, and then you're on your way. Like the Chinese proverb says, the longest journey begins with the first step. Well, that's what you've done. If you did that yesterday, you took one step towards better mental health. Now today is number 2, 3, 4. A year goes by, and all of a sudden you're improving. And keep in mind, improvements come slow. So again, I'm being honest with you. I'm not trying to give you some kind of crazy claim just so you watch the channel. I'm not doing that. I'm telling you that these things have been proven. These things are tried. You can Google it for yourself and look it up. These things work. So that's what you want to do. You want to command your muscles, go take that walk, get involved in an exercise program if you're willing to do that. There's plenty of them around. Take an aerobics class, show up when you have to, when you don't feel good, when you're anxious and depressed. And you're going to learn that as you move your muscles and you command your muscles to do things, yard work, anything, absolutely anything. You can wash and wax your car if that's what you want to do. Just do something with the muscles. Get yourself moving. and you're going to start to see, you're going to start to learn that the brain here is being taught by, actually being taught by the muscles, and starting to re-educate the brain. That's what we're after. All right. Let me pray for you today. Father God, I just ask you to help my friends and the subscribers that are coming in now, the new people, and help them to understand that these things actually work. Give them the peace of Christ. Give them the peace of the Lord, I pray today, in Jesus' name. All right. Short lessons remind you that these lessons are very small installments on a very big subject, so you want to be with me as much as possible. Every day would be optimal, but as much as possible. All right, for those of you who are just dropping in and you're interested in, I'll say, seeing if this really works, subscribe. If not, you want to audit it, that's fine too. But if you'd like to subscribe, please do so. Hit the notification bell so that you know that when I've uploaded a video. And as always, I appreciate the thumbs up if you're getting something out of this. I also appreciate comments. If you're finding that these things work, or if you're stuck in some area, since the group is small right now, I take time to read the comments and answer as many as I can. So if you have questions, put them in the comments below, and I'll do my best to address them so that we can all, make progress here. Okay? All right. God willing, and the creek don't rise. I'll be with you here again tomorrow on the Oasis. And until then, I pray that God blesses you in everything that you do. See you tomorrow.